body's outer layer is called your integumentary system. Your skin, your hair, your nails, and your glands are all part of it. Physical therapists support people who are ill or disabled in moving more freely and managing their pain. They are frequently an important factor of the healing, rehabilitation, and preventive care provided to the individuals with long-term illnesses, injuries, or conditions. Occupational therapists utilize therapeutic uses of daily activities to treat patients who are wounded or ill or incapacitated. The skills these patients require for daily life and employment are developed, recovered, improved, and maintained with their assistance.
Significant functional restrictions and handicap can result from a variety of integumentary wounds or impairments in skin integrity, repercussions, and any related wound side effects such as inflammation, discomfort, edema, and scarring. Physical and occupational therapists need to understand how crucial the integumentary system is to everyday human function. They ought to be able to offer remedies or strategies to stop the deterioration of skin integrity. Physical therapy and occupational therapy practice must include the proper care of individuals with varied skin problems.
Integumentary system is important to physical therapists and occupational therapists as it plays the integral role in the health and function of their patients. PTOT use integumentary system to assess the overall health of their patients, diagnose and treat pathologies, and provide preventative care. Studying integumentary system helps PTOTs to understand anatomy and physiology of their skin, nails, and related structure as well. Their pathologies associated with them. And this knowledge is essential for providing safe, effective, and evidence-based care.
The human skin is the largest organ of the human body, and as future physical therapists, it will only be natural for us to involve and interact with our patient's skin. Having knowledge of the integumentary system can help us provide proper care and interventions such as bandaging and wound management that can help our patient recover from their conditions.
Physical therapists are responsible for helping the patient restore their maintain maximal physical strength, range of motion, and overall physical functions. They use variety techniques including stretching, strength training, and hands-off manual therapy to improve muscle strength, their flexibility, as well as to reduce the pain and improve overall functions. Physical therapists may also improve education and guidelines to the patient in order to prevent future injuries. Occupational therapists are responsible for helping patients restore their maintained functions of the upper body and core muscles, as well as the coordination of the strength. Their hands and arms, they use variety of techniques including strengthening exercise, stretching, and hands-off manual therapy. To improve muscle strength, coordination, and flexibility, they also provide education and guidelines to patients on how to use assistive device and adaptive equipment to improve their ability to perform daily tasks.
It's important for as a physical therapist or occupational therapist student to be knowledgeable. They should be knowledgeable about all the systems in the human body, as they are responsible for the well-being of their future patients when they eventually become licensed physical therapists or occupational therapists. It's important to be conscious of the different processes and physiological mechanisms that's going on, so you can give the proper treatment to the patient immediately and effectively and appropriately to whatever condition they're experiencing.
The primary purpose of the muscular system is to enable our ability to move. Muscles pull in the joints that therefore allow us to start moving. They actually take part in each of the body's functions, and since physical therapists help to improve or restore mobility, understanding how the muscular system functions is vital and should be mastered, especially for us future physical therapists. Because I am certain that we'll be dealing with muscle related conditions soon, so it is crucial to understand how muscles in every area relate to the issues we may face in the near future.
PTs and OTs are responsible for the understanding of the anatomy and the physiology of the human skeletal system. Knowing so will help the PT or OT to understand the structure and the specific range of motions a person can perform. Damage or impairments in the skeletal system can restrict or cause pain in the movements of our joints and muscles. The PT and OT are not only responsible for recovering physical function of the bones, but it's also their role to educate the patient on how to perform proper body mechanics, body control, and proper posture.
Physical therapists and occupational therapist students should be knowledgeable about all the systems in the human body, as they are eventually going to be responsible for the well-being of their own patients. They should be fully conscious of the different processes that happen as when they finally become licensed um, professionals. uh, you know, it's important that they understand the physiological mechanisms that go on in the human body, and this helps them with uh, caring for their patient. It makes it easier to diagnose and evaluate and eventually and then finally treat their patient. So it's very, very, very important that they know, they study this.
The skeletal system plays a crucial role in physical therapy as it provides the framework for movement and support for the body. A thorough understanding of the skeletal system and how it functions can aid in physical therapists in assessing and diagnosing musculoskeletal conditions, developing and implementing treatment plans, and evaluating patient progress. Additionally, knowledge of the skeletal system can also help physical therapists to better understand the mechanisms of injury and how to prevent them.